problem, is it?
Thought I heard the background start.
I hear you guys talking. Out there in the neighborhood.
Well, hello, y'all. How y'all doing tonight? I hope you're doing well. I am Keith Johnson, and I need to hit mute on something. There we go. That was my problem, y'all. Don't blame Kevin about that. I hope y'all can still hear me because I had to mute something here. And if Kevin, if you can't hear me, do something. Or Mark, if you can't hear me, do something so I can fix it.
I can hear you loud and clear.
Nope, I'm not hearing Mark now.
Oh, I can hear you.
Give me just a second. Let's try that. How about now? Are we good now?
I got you.
All right, we are good now, even though I just lost my feed. Oh my goodness, it has been a day, y'all. Thank you for coming out and joining us tonight. If I'm involved in this, y'all, something's going to go sideways at some point. So let's hope that this is it right here at the beginning. I am Keith Johnson, obviously, and joining me tonight we have Mark, aka Lugnut. How you doing tonight, Mark?
Good. How are you, brother?
I am doing well. Well, that's a lie. That's a lie because I'm obviously
ready to roll.
I'm not in the studio tonight. Some of y'all may know I was in the ER a week ago Sunday due to kidney stones, and they are reminders. The doc, when I was there, he's like, "Yep, you're here for a kidney stone," and he gave me some meds there, and he's like, "Your scans show that you'll be able to pass these eventually. So go home and have fun." And if you've ever had a kidney stone, you know how much fun they are. I have them in both my left and right kidney. I have multiple that I'm dealing with right now. So anyway, I hope everybody is doing well. We've been discussing, last week's live was all about community and how the community is really what Invisible is. It's not me. It's not Amy. It's not Jennifer. It's not Kate. It's not Leslie. It's all of y'all. This whole thing started with me complaining in the back, sitting behind the wheel in a van about a really bad doctor's appointment with my previous pain doctor. And next thing I know, we're over 2.5 years later, and here we are on a YouTube channel, partnered with a great doctor, a great clinic, a great dietitian, and a guy that's worked in baseball for decades. And we're able to get a lot of information. And I am not an advocate by any stretch of the imagination. I said it before, I'll say it till the day I die. If anything, myself and anybody ever associated with Invisible, we focus on education. We focus on trying to get information out to people with one main goal, so people can have a better quality of life, so folks can get better. And last week we talked with Leslie and Kate about a friendship and a partnership that started through Invisible. Kate being on the East Coast, Leslie being on the West Coast, yet they both got to come together for an amazing event where Kate got to get a service dog. And Leslie, living in Sacramento, was able to give tips and tricks on where to stay and where to eat and what to do and what museums to go to and all this great stuff. And none of that would have happened for them had it not been for Invisible. They'd have never met. And I'd have never met a ton of great people. And Mark is one of these people. Mark is from New York. And as a Texan, I'm supposed to hate Mark, but I'm supposed to be born with this angst towards Mark because he lives in New York. But I don't. I love Mark. I love him as a human being. And I have a lot of compassion and empathy for Mark because Mark's story, as you'll hear tonight, is very, 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 very difficult. Mark has been dealt a hand that most, as Kevin calls them, most invisibles, they could never comprehend and they could never handle. And while Mark's life is at the moment is not all wine and roses, especially the wine part, there's hope now. And hope is a beautiful thing. And we always do victories at the end of the night, and we'll do them tonight. And we do those as a way for people to share their victories and give the rest of us that haven't had a victory a little bit of hope as we go through the next week. And my hope for tonight is after you hear what Mark's been through, that you'll leave with a little bit of not only just hope that you can get better care and have a better relationship with your doctor, but you're going to leave with some hope tonight that maybe things can get better in your life for you and that your quality of life can get better. Mark has had, like I said, he's had a very, very difficult road. Dr. Leak and I did a series of podcasts, and we had like 5 or 6 topics that we talked about one specific thing. And one of those topics was on dealing with addiction and or alcoholism as a chronic pain patient. And Mark was really the reason behind that, because I believe there is a big part of the invisible community that deals with some kind of addiction issues. And we wanted to get tips and tricks and try to figure out how people who have addiction issues can still why they still need the care that everybody else tries to get. And I want to say thank you from Mark for allowing us to bring that up, because that was Dr. Leak got to choose all the topics and I got to choose one. And that was the one that I really wanted to do, because I really feel that represents we needed to do that to represent the entire community, right? Because I've preached and everybody preaches. Invisible, it doesn't matter how you got into the club. We hate that you're a member of the club, but damn it, welcome. Politics aside, race, gender, LGBTQ plus, Hindu, Buddhist, Christian, atheist, I don't care. Invisible doesn't care. We care about that as it applies to you in your life, because we care about you as a human, but we won't care about what you've gone through and how can we all work together so you, even being a New Yorker, can hopefully get better care. And I think Mark's story is a good one for us to celebrate and to learn from. Mark, I guess we'll just start with your journey there. I don't know, like 4 or 5 years ago, you had an interaction with the GI doctor. Is that right?
Yeah.
And that really started you down a really incredible path, didn't it?
The interaction started, actually, it lasted about 10 years.
Oh, wow.
Because of pancreatitis and such.
Okay.
So yeah, he had seen me in the hospital every time I was in there, and I was in there no less than 10 times in a 10-year period, 5-year period, I don't even know. And they told me everything that was going wrong every time I was in there. And it was because I was drinking.
Right.
I would stop. I would go in the hospital. They'd treat me for 5 or 6 days, let me go. I'd feel better when I got out, and I'd start right back in again. Sometimes it was 6 months before I went. Sometimes it was a year before I had to go back, but I always went back.
Right.
I had a choice to make the last time I saw him. And he came in and said, I'm dismissing you from the hospital. He said, all your lab works are as numbers. He said, they don't mean anything until you stop drinking. And he told me that the next time he sees me will be in an obituary or in ICU when he comes to visit me. If I kept drinking.
Wow.
And I should have asked him to stay and get detox in the hospital, but I was mad. I was stubborn. I was pissed off that he talked to me that way. I came back home. I believe I must have texted my ex and told her she needed to have the kids for a few days, and I went through detox laying on my floor in some of the most vile conditions for, I'm guessing, 3 days. I was seeing things. I was losing my mind. Of course, I wasn't taking any of my medication.
Right. And real quick, I want to jump in. If anybody is dealing with addiction or knows somebody that is dealing with addiction, please do not try to detox at home. Please, because that, I think, Mark, you'll agree, you survived, right?
I am. Why I think I survived is because at that time I was already on gabapentin for my nerve pain, and I think that's what saved me.
Really?
Because it's a anti-seizure medicine.
Oh yeah, it is. Yeah. Well, that makes a little bit of sense, right? That you had some of that still in your body. I don't want to pretend that I can understand what it felt like to have a doctor that you trusted say, I'm either going to see you back in the hospital or see you in the obituaries, because I can't imagine what that hit like. But I also can't imagine after you got through the detox situation, when you went back to see him in a few months, how you felt when he walked in the room, right? Because he was like the first person to do something.
Yep, when he was. It was about 5 to 6 months after I had stopped drinking. And I went into his office, and I remember his nurse took me back into the room. I waited, and he walked in the room with the biggest smile on his face. And he came over to me and he shook my hand and he said, "Congratulations." And he was the first person to do that. And I must have had a look on my face, like, what do you mean? How do you know?
Yeah.
And he said, I told you. He said, I wouldn't see you here if you kept drinking. You wouldn't be sitting in my office right now. So there it was. Ton of respect for him. And I still see him for regular checkups now. So,
right. But that had to be, because I'm imagining you're going through these early stages, these early months, because you've got like 4.5 years now. Is that right?
4 years and just about 5 months. So yeah, I get there.
So those first few months, imagine a lot of these battles, besides possibly going to a 12-step, you're doing a lot of the stuff solo.
Yeah.
And with certain family members, I'm not seeing the possibility of a lot of attaboys, as you're going through those first months. So you walk in and you have a doctor tell you congratulations, and have them really be the first person to congratulate you on making it through.
Yeah, it was good. I didn't give my family much reason to believe me at that point in time that I was going to quit. So
right.
It was,
yeah, unfortunately.
I had to earn that,
Yep. You have to earn that back. But even once somebody like you can do all that work and get sober, you're kind of still dealing with a lot of physical issues that can be traced back, that could have been caused by addiction, right? Yep. I mean, I'm looking at your at your diagnosis list here, and y'all know, even though Jennifer does a great job and she spells these out phonetically for me, it's 3 syllables. I'm going to butcher them, y'all. The first one I've got chronic pancreatitis.
Pancreatitis, yep.
Scarring and severe chronic pain, poor digestion. This condition alone can cause extreme pain. Then this next one is spelled SYRINX, syrinx.
Syrinx, yep.
Of the spinal cord, fluid-filled cyst inside the spinal cord. It's a myelopathy, spinal cord compression. It's neurological dysfunction, nerve damage and weakness, sensory changes. Extremely painful. Is that the one, the diagnosis that you were talking about? Like sometimes you go to grab, like you're grabbing a spoon, but it feels like you grab 5, or you grab 5 spoons and it feels like 1, something like that.
That doesn't help because it affects my, limbs. But I got to look at it. Dysesthesia is how I say it.
Okay.
The best way I can explain it, two good ways. And I was sitting here watching TV one night and I jumped. I was literally scared because something touched my leg and nobody else was here. So I jumped and I looked down and my own hand is on my leg. It just, those nerves didn't go to
your brain. So
brain.
it's like this separation that's happening.
It's like a disassociation, like you were talking about, the other day. You reach into a drawer to grab a fork, and I swear I have one fork. I'll pull my hand out, and there's 5 of them in my hand. So
that's a nightmare. I mean, I'm so obviously you're beyond an initial card carrying. You're an overachiever member of the invisible community, and I hate that for you. You're battling. You're dealing with alcoholism, and then you have these incredible diagnoses, some of which cause a lot of pain. How has addiction complicated your care search? Because like I said on the intro, Dr. Leak and I we did a whole podcast. We talked for like 45 minutes on this one topic alone, and Dr. Leak and I we agree on some things, and we agree to disagree on other things. And this one we definitely agreed on, because it's a no-brainer to us that if somebody is battling addiction or not, they deserve to have their pain treated in appropriate ways. So has it caused any issues with you in trying to get good care?
Yes, it has. Unfortunately, there is a stigma that comes along with it. It's still, I want to say it's getting better, but it still exists today.
Right.
See, people they always don't look at you as an alcoholic or heroin or you name other drugs. They look at you as an addict. And that's how you're wrote down in your files. So they don't always specify what you were addicted to. So that makes it tough when a doctor you don't know opens your folder and he sees addict in recovery. He wants to close it awfully quick because you just became too risky
for
them to treat your pain.
Even though I'm imagining you would do a lot of the things that Dr. Leak suggested, additional urine tests, you would do additional pill counts, you would do whatever these annoying hoops to go through, you would be more than happy to do those, right? To a certain degree, until you establish yourself, right?
To be honest, the first pain doctor I went to was actually an acupuncture doctor, pain doctor. And he dismissed me within 2 seconds when he opened my folder. And he said, "What do you want?" I said, "I need help managing my pain." And he said, "Nothing I can do for you." Closed my folder, walked away, and I was left with...
Which is so annoying. I know acupuncturists. I know people who have gone to China to train to be acupuncturists. And that's one of the things acupuncture can help with is addiction and cravings and things like that. And for the doc who's supposedly trained, that's why I tell people, if you're Googling an acupuncturist and it says they graduated from University of Nevada, Las Vegas, don't go to them. They could be the nicest people on the planet. I am sure they love puppies and kiddos too, just like a normal human being. No, find some dude's name you can't trust, you can't read or pronounce. See where they studied. There's guys here that I can't afford to go to in Dallas that have on their verified work history 10 to 15 years experience teaching acupuncture in hospitals in China. Right? Those are the people I'm going to go to, because those are the ones that actually understand that with acupuncture, it's not just the needles, it's the herbs that go along with it, it's the exercises that go along with it. I think I've told some people that one acupuncturist, she actually cut my ear so I could bleed out, right? And it worked. It was the craziest thing. But it's the stigma, and we're going to get into it here very shortly of why you'll hear Dr. Leak, and you hear myself, and you hear Amy, you'll hear Jennifer, you'll hear Kate, you'll hear Leslie, you hear all these people who've been around the block say, try to get that relationship with your doctor. The goal being, have them, when they have your file and they're about to walk into the exam room, they look at your file and it says Keith Johnson, and they go, "Oh, it's Keith. I wonder what the hell's wrong with him this time," right? Yeah. Instead of, they see Keith Johnson and the very first thing is nerve patient, radiculopathy, neuropathy, and everything like that. Because if they know us, they know that we're fighting battles besides our chronic issues and besides our diagnosis, which will help them to be inquisitive when they see us and they stop seeing us as a diagnosis. It's the same battle we fight, y'all, with family members and friends and loved ones, where they only want to see us as this diagnosis, as a pain patient. They need to see it. We need to fight really hard. And that's why I tell people to share your story, because it can't be invisible. We have to be seen as Mark, as Keith, right? And while you're kind of fairly new with Invisible, you've been pretty consistent in hanging out and doing lives and doing videos and participating in the lives and the podcast that Dr. Leak and I have done. And so you've heard us talk about, as well as Dr. Mike. Y'all, if you don't have Dr. Mike's book, You Are More, I don't get paid for any commission on that book. I agree with about 95% of it. I'd suggest, if you can afford the $15, spend the money to get the book. I think you may actually have it on Kindle now, where it's a little less expensive. Yeah. Because Dr. Mike and myself and Dr. Leak will talk about a 3-minute conversation, right? And a lot of people will hear that and think that's only for when you go visit a new provider, a new GI doctor, or a new rheumatoid arthritis, or a new neurologist, or a new PCP. No, we've always meant that for new or existing. If you don't have that, if you don't feel you're getting the care you need from your existing team, try to build that relationship and see what happens. And it's not just me. The person you see on the screen, depending on how it's looking, on the other side of me, sitting right next to me, Mark, you did that, right?
Yes.
You put together like a 3-minute thing, and you wrote down on a note card or a piece of paper certain topics that you wanted to get across to your pain doctor, and so that they could see, maybe get a glimpse of you and what your lived experience was like.
This was my PCP.
Right. Yeah. I'm sorry. Yeah. Not the GI. It was your PCP.
Yeah.
I'm sorry. I kind of left that part out. Well, how long had you been seeing your PCP?
I can't, at least 8 years, at least.
And so you're gaining all this knowledge about build a relationship and how to advocate for yourself, right? And you're hearing all these crazy, wacky ideas, of at least trying. And if we know, if we honestly tried and it doesn't work, we know it's not on us, right? We know that it's on somebody else. And while our care may not immediately get better, we can rest in the fact we did everything we could do. Mm-hmm. And that responsibility lies on the other person, or the hospitalist, or whoever it may be. But you've seen this guy for 8 years, and it seems to me like it kind of came down to it. It's like, I see it almost like screw it. If this works or not, I've got to get this point out. I've got these appointments. They're adequate. I'm getting my maintenance meds, but I'm not getting anything else.
That's all it was with maintenance.
And it seems like you finally just said, screw it, I'm doing this. And if it doesn't work, I got to go find a new PCP. Mm-hmm. Is that kind of where you finally got to it?
That was it. And like I said, though, being an alcoholic for so long and hiding things from people, you have to build up that trust, just like I had to in my PCP once I stopped drinking.
Right.
He had to know that I was still stopping, so that I was serious about my health too. So,
and I think before we go any further, and before I get into more about this appointment that you had and how it's dramatically changed for you, I think what that also does is it shows our care team we have a damn interest in our own care. And I think I've lived it. I've lived it with quote unquote adequate doctors, where I've taken what I could get, and I was happy with it. Was it ever enough? No, but at the same time, it was better than nothing. But my quality of life was crap because of what I wasn't getting, because I knew I needed more. And I think when we have part of the benefit of trying to talk to our doctors and build that relationship is we show that we're wanting to take partial ownership of our care plan. We want to be involved in it, and get us we want to play a role in the decision making. We want to let them know that we're Velcro method, man, throw it against the wall. Let's give this a shot. And,
lose,
and I think if we show as we want to be active participants, as that helps convince them that we're not just our diagnosis, that we honestly do want to try to have a better quality of life and possibly get better if we can. And eventually, for some of us, unfortunately, we're not going to get better. And Mark, unfortunately, a lot of your diagnosis says there is no cure, right? So it's going to be a constant battle from here to eternity. But I think your doctor sees now that you've always felt that you wanted to be involved, but I think maybe he sees that you want to be involved now.
Yeah, I think I definitely made an impression. So
good. So how was it when you're sitting down trying to figure out, okay, I'm going to go talk to my doc? I know white coat disease is real, syndrome is real. We all get nervous about seeing our doctors. I get nervous before I go see Dr. Leak still.
That's why he doesn't wear a white coat now.
See, there you go. He wears those I don't know. What do you call those people? He tries to dress
like a normal citizen, so it puts everyone at ease.
He still wears skinny jeans.
Really?
Yeah.
Doc, if you're out there and you're hearing this.
I know he is.
Those days of skinny jeans for me are long gone, trust me.
My skinny jeans are like enough material to make a tent. Nobody wants to see me in a pair of skinny jeans.
No.
But he's skinny as a twig, so he can get away with it. Yeah, he gets away with a lot more than what I can. He's much better at everything. God, I just popped a visual in my head of myself looking myself in the mirror in skinny jeans. Oh my God, what a nightmare that would be. So you're dealing with white coat syndrome, but yet you're writing down a list, and so you get to this appointment, and I'm guessing everything's just like status quo. He walks in, he's got his laptop open, he sits down and he starts typing away notes, right? And you're probably to the left or to the right or behind him, and he's just asking generic questions, like, how are you doing this week? Anything change? Did you have an amputation you didn't tell me about? Because he can't see, because he's not even looking at you, right? So you get through all that, and so you still have your topics, right? So how did you broach them to him? What did you say?
We started wrapping up, and I seen him starting to get up, and I said, Doc, Chad, I call him Chad. We are on a first name basis. And I said, Chad, I need you to sit down and put your laptop away, please. I said, I need you to hear me. And he turned around and he put his laptop down and he sat down and started listening to me. And I had a list of the diagnoses that, as of 2 weeks ago, my neurologist finally nailed them down after 5 years and said, this is what you have. This is what we can or can't do. So I sat down and I started telling him the diagnoses that I had, and he looked surprised. And I said, don't you have them? I said, you don't have anything from Dent?
From another doctor, right?
What's that?
He didn't have any like records from other doctors or anything like that.
My neurologist, he didn't have a record in there.
Oh wow.
And so he got up and he went and saw his nurse, or he sent somebody on the mission to get it.
Right.
And they got it figured out. It was some kind of software glitch or whatever. And it came in and he said, oh, and he looked through it for a minute. And he said, okay, well, what's next with you? And I explained that I have labs coming up for some blood work that needs to get clarified or unclarified before I can move forward on a lot of things. That's happening next week. But I told him, I can't remember how the conversation, he asked me what was next, and I told him. And I said, to be honest with you, Chad, I said, I need, with all these symptoms and problems, I said, I need help managing my pain. And I said, it may be time for me to go look for a new doctor. And he stopped in his tracks, and he looked at me, and he said, there's no need for that. We'll figure it out. I was like, whew, avoided that one.
Dodged that bullet, literally. Now, y'all, Mark, you've been searching for any kind of help with pain besides gabapentin for years.
Yes.
And you have at least 5 years, and you have travel restrictions. It's not like you live in New York, but it's not like you can just jump in the car and drive to New York City in a heartbeat, or jump on a train and get to New York City in a heartbeat. That's a day's travel.
About 8 hours, yeah.
And if for those that haven't gone into New York City, the train systems can actually work really well. At least when my experience coming from Long Island in downtown, that works really well. But at the same time, it's not quick. You find yourself running to get to trains to make sure that you don't miss it, so you don't have to sit there for another hour and a half, 2 hours to wait for another one. It's tough for me to make a trip to see Dr. Leak in a car and spend 3.5, 4 hours in a car to make an appointment. For a lot of us, we understand that spending 8 hours to make one appointment is just a non-starter, right?
To be honest, I am closer to Cleveland, Ohio, and Erie, Pennsylvania. The problem is they're two different states, and Medicare won't cover them unless it's an extreme emergency.
Yeah.
So
you've been fighting this for a long time, and finally your doctor was like, you don't have to go anywhere. We'll get some stuff figured out. So obviously one of the big communication issues is they didn't have any of the files from your neuro, right? And that's a big kerfunkel right there.
But he never bothered to question me on that or ask me.
Hey, I'm not defending him. Don't worry. I'm not. But that's an issue. But yeah, he never bothered to ask you about it. And that's kind of that's a hard kind of feeling when you're trying to explain to a doctor this is going on, and they don't believe you, even though you're being honest, right? So, so you explain these things, and he's got this type of stuff now, right? And is he like trying to be more investigative about like possible arthritis type stuff, and this is stuff that wouldn't have happened had you not said, literally chained into his chair and then say you're not leaving yet?
We don't have a rheumatologist anywhere close, and everybody wants me to see one because of the arthritis in my back and stuff.
Mm-hmm.
So I talked to him about that after we'd had our sit down and we were on the same page.
Mm-hmm.
And he said that another PA in the practice has experience with what did I just say?
Like arthritis,
rheumatologist.
Mm-hmm.
He had done some training in that. So he said, once this blood work's done, I will be talking to this other coworker, and we will figure out what test to give you as if I was your
rheumatologist. And this is happening. This isn't something that would have happened 6 months ago.
Oh,
right.
Keith, I wasn't even ready to confront him 6 months ago. I mean, I had to see you guys telling me that and telling me that it would work before I had the confidence to do it.
Well, I mean, we try to tell people it may work, right? Because we understand some doctors are just, they're buzzsaws and they're never going to change. Ask me off the air and I can give you one that's in Fort Worth right now. But I'm keeping my pledge to Dr. Leak, and I'm not going to mention that guy's name. But there are buzzsaws that is my way or the highway. They are God. They know what's going on. You know, nobody knows my body better than them. But in a lot of situations, again, it goes back to my personal feelings. And yeah, unfortunately, y'all, my personal feelings get put into a lot of what Invisible Kim kind of pushes. We try, and if we fail, at least we know we tried, right? We know that we put ourselves out there. And Mark and I were talking earlier today, and I described what Mark did and what patients do and what Invisibles do when they come to their doctors and they try to start these conversations. I describe it as humbling. I feel like when I went to see Dr. Leak the first time, I was humbled when I walked in there. And I don't mean that in a derogatory way at all. I really don't. I think when I use that term and what I'm describing is I went in raw. I went open and I had my walls down. And I explained where I was, how this current situation wasn't working for me, what my quality of life had become, and I just laid it out there. And so if I say humbled, well, I humbled myself to do it, or Mark humbled himself to go talk to his doctor. Don't take that in a derogatory way, like he was weak and he bowed his knee down to his doctor. No, he just took everything out and it was just him, raw, open, and honest when you walked in, right?
That's right.
And for you, so now you went from at best an adequate doc. He was there for your reoccurring, I don't know if you have blood pressure or whatever, the reoccurring meds like that, right? He did good care with that type of situation, but there wasn't any care towards this pancreatitis or any of these other type of issues that might be happening. He definitely wasn't the type of doctor that would investigate what rheumatologists might do to help with this arthritis you're having, right?
I really couldn't believe the change he did. I mean, if I'd have told myself a year ago, I wouldn't have believed he was going to change that way.
But then you've got a message through your patient app, right? So share this one, because this to me is like the ice. It's like the cherry on top would be that you finally get pain meds, right? But this is pretty damn close.
So I get a message in my portal from one of his nurses, and she said, Chad wanted me to reach out. We just got word that there's a new pain management doctor moved into our local hospital because there was such a need for it. So when you see him in a week or two, we can discuss that, about getting you into that. I read that and I was like, holy crap. Who is this guy? You know? What's he turning into a unicorn in 1 week? You know?
Because let's be honest, how many positive messages, new messages, not test results, but new messages have you received from your doctor in 8 years through that app?
Not one.
No, not one. Right?
No.
And then all of a sudden you go and you humble yourself and you have the conversation and you let this guy see Mark and have an idea into Mark's, you give him a peek into Mark's life and how your diagnoses are actually controlling you and preventing you from doing X, Y, Z.
Yep.
And it sparks an interest in them. Right.
You know, I think that was some of it because he found a challenge in it. And we know these doctors, we've talked about it, they have their 10-minute rule. on to the next, on to the next, on to the next. And I was wondering if maybe that didn't pique his drive on why he became a doctor again.
It could have. I mean, it very could have. Maybe that's something, Doc. If you're near a computer, if you want to type a comment, what do you think? Because, or Evelyn, if you're around Doc, ask him to see if we can get his opinion. Because maybe so.
Yeah.
But I think it goes with that. But he also goes to see it's Mark. And it is a challenge now. It's not just what's your blood pressure, how's your cholesterol, do you need boner pills and that type of stuff, just typical boring PCP stuff, right? Now
he has something every year. Your new insurance wants you to get a physical. Come on in,
Yeah, that's exactly right. And now you're crossing into more than just a patient, in my opinion. And I think that's why, while we can't guarantee it's always going to work, why we stress with people to try to have a conversation with your care team. And if you can't have that conversation that answers the big question, in my opinion, if your doctor's not willing to sit down and at least listen to you talk, then we have to address, and you have to address as a human being, as a person inside your own brain, is this the care team that you want to stick with?
Right.
And my hope and prayer is that they'll listen. And if they can't go as far as what Mark's doctor is, at least they can make some progress. Right.
Yeah.
And
go ahead.
No, go ahead. What were you going to say?
I was just going to say that we had talked earlier, and I told you I was nervous as crap when I told him about finding a new doctor, because I didn't want to have to go find a new doctor, and start all over again with all my medications and have my prescriptions cut off before I found one. So I was scared when I said it, but it worked. So
it can work. And and if it doesn't work, it's not your fault.
Yep.
It's not your fault. And I think a little side rant here, I think as invisibles, we take on so much personally. And what I mean is, I was explaining in our group gratitude chat text message group the other day, this body inventory that I do some nights at 3 or 4 o'clock in the morning when my pain insomnia has me wide awake. And I'm finding I can't find ways not only to control my pain, but control what's going on up here, which is what's really keeping me, the pain and then what's up here is what's keeping me awake. And so I'll start literally at the tip of my toes. And then I go to the soles of my feet. What am I feeling? Are they okay, or are they hurting? Okay, they're hurting. What type of pain is it? Is it an ache? Is it a burning? Is it a sharp pain? What type of pain is it? And then I'll answer my question. It is burning. It feels like I'm standing on blowtorches. Okay, is this a new pain, or is this something that you've experienced before? Well, I experience this almost on a daily basis, so I've experienced before. Is this at a level that's worse than any you've ever experienced in your life? Tonight, no, but it's really, really bad. And then the important thing for me that I have to do is, once I realize that, no, this is not any worse than what I've ever experienced, is I have to tell myself, it's okay to hurt. You're not doing anything to make yourself hurt. Your nerves are trash. Your spinal cord, your nerves, your whatever is your POTS, your diagnosis is what's causing you to hurt. And as much as I don't want anybody to hurt, we have to say, okay, I recognize it hurts. I didn't do a damn thing this time besides just lay here. And I think that's a mental switch that if some of us can make, to give ourselves the credit for realizing, we didn't do a damn thing to hurt. I think some of us, I know for me, that works. I have to look at it that way at times, because if I don't allow it to be understood that I didn't do anything, that it's just how my body is jacked up, then I take the blame for my body hurting. And all right, that's my in the weeds segment rant there. But
I had to grieve and get over the fact, Keith, that I did do a lot of this damage. you know.
True.
So I felt like when I was going to my doctor, going to other appointments, it's just like, yeah, with my head down, I was an alcoholic and I did all this shit to me, you know. I guess I can't ask for help because I did it. I had to get past that next step in recovery where I could forgive myself.
There you go.
And start moving on as a recovering alcoholic and not just an alcoholic still or an addict.
In my non-licensed opinion, if you would allow yourself to blame yourself for your past behaviors causing everything, or if a chronic pain patient who doesn't have any addiction issues to say, I overdid it again today, it's my fault, then I think that's going to be a permanent block for us to go forward in our mental care. And I'll go to the grave saying our mental has a dramatic impact on our physical. And if we can't find ways to get the mental a little bit better, our physical is going to continue to get worse. And then it's a cycle, and they'll feed on each other, and then nothing gets better. Right.
I had to work on my mental health first. Immediately, the first place I went was my therapist and counselor when I stopped, because I needed that. Needed to fix my depression and anxiety before I could stay sober. So yeah, right along with it. Yep.
Yeah, I think that's a big thing. And I understand we can't overdo things. We can do too much. We can play with our grandkids too much. We may lift something wrong. But overall, in my opinion, and again, I'm only licensed to drive a vehicle, that's not the true cause of my pain. My nerves are jacked up, and they're going to hurt no matter what I do. It may be worse tonight, right? And one other thing I want to say about this inventory, if you want to know more, let me know, and I'd be glad to talk to you guys one-on-one about it. One important question that I have to ask myself is this new pain. So like when my feet are keeping me awake or my thighs are keeping me awake, and I go through the whole thing, is this a new pain or an old pain, or have you experienced worse, or is this somewhere up, below the worst? I have to make sure I ask myself, is it a new pain? And if it is, does my doctor care team know about it? Because a lot of us as invisibles, especially chronic pain patients, you don't have to agree with me in the comments, but that's fine. We won't tell our doctors that something new is coming up until it gets to an unbelievably bad level.
Can I ask you, I know you've just been dealing with kidney stones. When I get a new pain that I have, I freak out.
Yeah.
I go, whoa, what is that? It's not right.
Yeah. I think for a lot of us, it goes back into that. I don't want another shingle. I don't want another diagnosis. This is just going to be temporary. It's going to pass, and that's where I was with the kidney pain, right? I fought it for months until a week ago Sunday. I'm literally on the phone 911 asking for an ambulance to take him to the ER because of kidney stones. I didn't get the treatment that I was hoping to get, which would have been, we're going to take you in, we're keeping you here overnight so we can bust them up tomorrow so you can pass them. Instead, I've got, you have kidney stones in your left and right side, but you should pass them. Go home and have a good life.
Gee. Can't wait for that to happen.
Good night. Oh, the passing them is a hard part. It's just when they move.
Oh yeah.
Jiminy freaking Christmas.
Ladies would have never had to deal with those.
I've said 1,000 times, the only person I wish kidney stones on is my ex-wife. And she truly 100% deserves them for her behavior. But that's a whole other. That's why my therapist gets paid, and that's why she gets discount cards for the liquor store because of my stories and my trauma and everything like that.
Yeah.
So you went from an adequate doctor, right? Not a mean guy, a guy that probably, like I've said, likes puppies and kiddos, right? Okay. Probably donates to the United Way every year to make himself feel good, to having a doctor that has a piqued interest in your care. And do you feel, I'm just going to be blatant and promote Invisible's community here. Can I ask you, do you feel the Invisible community played any role from where you were 3 months ago with your doctor to where things are heading now?
Absolutely. It had everything to do with it.
Tell me how.
I'd have never found the courage if you guys hadn't been talking about it. And the whole community, you know, talking about advocating and stuff. So.
Because it's not just the one diagnosis, right? I compare myself to Kate, who was on last week. Mm-hmm. Kate, God, an incredible human being, more near-death experiences in one person's life than anybody should ever have. And yet I love how she says how Kate says that they continue to live out of spite just to piss the doctors off. Right.
You know, she's so positive.
I know. And I look at her list of diagnosis, their just diagnosis list, and I don't have any of that. Right. Yep. But I've learned so much. And plus you look at the age difference, the gender difference, you look at the geographical difference, you look at the education difference, you look at the work history difference. On paper, there's nothing. There should be no reason that I can learn from Kate. But I learn from Kate every single day. And I'm supposed to hate you because you live simply in New York. You have a Yankees hat on. God bless you. God, you know, I'll say a prayer tonight because you have the hat
Buffalo
on.
Bills.
No. I mean, I like the Islanders hockey team. How's that? But I'll give you that much. Oh, God bless. You're making it difficult to love you, Mark.
I'm within an hour and a half of Buffalo Bills and Buffalo Sabres. So.
One last question. Then I have a really cool promo, something that's going to happen Monday night. That's going to be a positive for the entire community. Guarantee it.
Great.
If somebody's listening tonight, somebody just stumbled across this podcast, this interview, on whether live or on video, and they're struggling with a chronic, if they're invisible, and maybe they're also dealing with addiction or are in recovery, what would you tell them? What's like one thing you want them to know?
If they're struggling already, get help. Ask for help. Sounds so easy and it's so hard. I know picking up that phone is heavy. Going in, I walked into an AA meeting, not knowing anybody. Yeah. Asking for help, just ask for help somehow, some way.
Yep. I love it. That's what it is. And it's so difficult. It's difficult I can imagine, for people in recovery, and it's difficult for invisibles.
Yep.
You know, because I don't want to say I will not say one's worse than the other. I think we share a lot of the same stigmas in some ways. People look at us. People can be in full-blown hell and addiction, but look okay on the street or at the grocery store. Mm-hmm. Just like somebody who deals with POTS, whose heart rate is going through the roof, can look normal, right, in appearance. And so it's that internal. Right. We share the invisibleness with that. And then
I think everybody could benefit from going and asking for a little help every now and then, you know?
Yeah, I think so too. And if you get pushback, I would recommend when the next time if you have a relationship with your doctor, if you're getting pushback from your family, because if you want to go to see a therapist or want to go to a group or something like that, if you have this relationship with your doctor, I would say, hey, I think I want to see a therapist. What's your opinion on it? And if they say, good, go for it. Just look at them and go, my spouse, my partner, my children, my family say, no, it's just going to be a waste of time. Can you put it in my management plan so I can tell them that you're making me go do this? That in order for me to get care, I have to go do this. And we can tell our family, our partner, our spouse, our kids, it's like, yeah, it's going to be bullshit too. I don't want to do this, but I got to go do it. And it's not a lie. The doctor says it's part of my plan now. Right. So
then you'll start learning.
Yeah. Yeah. I saw my therapist today for the first time. She had surgery for the first time in like 2 months. And I was prepping her. I was sending her memes. I was getting her psyched up to see me because I have to build her up for expectations because I'm such a train wreck. And when she saw me today, she's like, I'm ready. I have my mental jacket on because it's you. Well, Mark, I want to say thank you, but don't go anywhere because I want you to be a part of this thing that's going to happen on Monday.
Yes.
On Monday, I am going to be back on here, hopefully in the studio with Dr. Leak live. And we need you because this whole thing on Monday is about the invisible community, specifically chronic pain, but it doesn't have to be chronic pain. If it's a doctor, a neurologist, whatever that you see, a GI doc, we need your horror stories. What's the worst thing that's ever happened when you've walked into a pain doctor's office? It's the worst thing they've done to you. I have so many with my previous doctor. I'm going to change your diagnosis to fibromyalgia because nobody gets opioids for fibromyalgia. You're on a deadly high dose of methadone. I can't give you more or you're going to die. Your doctors in Las Vegas documented exactly why you need to be on the meds that you're on, but we're not going to put you there. We're cutting you in half because your doctors in Vegas proved that the nerve blocks for the radiculopathy in your low back were going to work. They did it 3 times per the insurance company, but they're wrong. You just need a shot in your SI joint and you'll be fine. Bend over. And literally that's what he did and was shocked that it didn't help. Right. So, but we need yours. And why do we need yours? There's an opportunity that I'm going to get to tag along with Dr. Leak to maybe make an impression on some baby docs that are going into pain management. And part of this, if this happens, is we're going to share your horror stories because they don't get exposed to a lot of it in school. They get exposed to it when they go to training and they get told your patients are going to do this or they're going to behave in these ways and everything like that. But they get told from the medical field's position instead of chronic pain. They've never been exposed to a chronic pain patient's lived experiences. So if we're going to have an opportunity to talk to these baby docs and to share the stories of what it's like to be a chronic pain patient, we need y'all's horror stories. So we need you guys to show up on this live. So when we film this live, because all of our lives, mine, Doc's, Katie's, Jose's, they all get posted as a video, right? So we can refer them to when we read your stories in the comments on this live Monday night. It's your chance to get your story in front of possible baby docs so they have an understanding of who you are when you walk into a doctor's office. Y'all, this is not something to take lightly because it's like, it's like I look at it like if I don't vote, I can't bitch about who won because I didn't go vote for the person I wanted to win. My bitching about who won doesn't carry a lot of weight because I didn't go spend the time to go vote. If I don't voice my opinion to these baby docs about what happened in my life and how they should see me when I walk in, then if I don't tell them how to fix the problem or who I am, then I don't feel I have a big voice in saying, well, you guys suck. They may suck, but I never told them why they could suck. So, Kimberly, the best way would be to show up on Monday night, 7:00 right here with Dr. Leak and I. That'll be the best way. Another way that might work is you can send like a minute-long video and email me, keithcpp@gmail.com. I'll send you my cell phone number and we can figure out how to get it. But the best way would be to show up Monday night so Dr. Leak and I can go through the comments and say, hey, Kimberly said this happened to Kimberly. And Doc Leak could go, well, maybe the doc did that type of conversation. And explain it from hopefully from Kimberly's point of view or from a chronic or an invisible point of view. And that's the conversation. And I'm looking forward to it because Doc and I, we have a really, I'm blessed. I know I am blessed. I have a unicorn's unicorn, but there is some fun. And when he and I have disagreements and we always agree to disagree. And we always walk away smiling in a better relationship after we disagree on stuff, but at least because we know where the other person stands. Right. So I think this could be a really cool live. And it's your opportunity to get your story shared to these potential baby docs.
Not just that.
How cool is that?
If they flood you with enough of them, I'd like to just go on record and say, hey guys, I'll hook up the montage. So send them over.
Yeah, do it. I think, again, it gives us a bigger, in my opinion, it gives me more of a reason to be able to bitch. And as a chronic pain patient, y'all, I love to bitch. As a chronic pain patient and a former over-the-road truck driver, I am good at bitching. Let's put it that way.
So, I gave you one pain management, and that wasn't even the worst one. I'll save my second one for Monday.
Save it for Monday.
That was worse than the first one.
I'm expecting some horrific ones that are going to have me in tears, and I'm going to expect some like my previous doctor, oh, I'm managing your pain, Mr. Johnson. If you still hurt, it's your problem, not mine. That type of stuff too, where we can all just shake our heads and beat our heads against the wall. So that's Monday. That's coming up Monday. But before we escape tonight, I want to do victories. If anybody has a victory this week, if something positive happened to you since we spoke last Thursday, please put it in the comments. I don't care. We're not visibles here. We're invisible. So yes, that would include, did you get a shower this week? Did you get to play with your puppy this week? Did you get to go outside this week before the storms hit? Did you get to do anything that you feel was special this week? To me, at times, that's waking up. I woke up at over 9 this morning in excruciating pain, but I'm here tonight, and this is my victory, is that I was able to make it tonight. That technology allowed me to make it tonight. So did you get a shower?
On the text messages and told everybody you weren't feeling good too.
Yeah, I did. I didn't hold back. So if you had a victory, please put it in the comments so we can celebrate it with you, because victories that you have are just like Mark's victory. They're just as important. They give people like me hope when I'm struggling and I haven't had a victory for a long time. They truly do give me hope. Valerie said, my double vision didn't hit as early today as it has since November. That's massive, y'all. The part of Valerie's NG is by like 10:30, 11 o'clock in the morning, she has double vision. Like there's no sense in even looking at the TV, double vision. Right? And can you imagine having to see two of me anytime she turns around? That's horrific. So it's taken so many things from her, like driving and stuff like that. And so for her not to deal with it as early is a massive victory. Erica, my baby boy's wedding was wonderful. I'm so glad I made the memories. That is awesome. Make those memories. We're going to pay for those memories, but so many of us, our diagnoses can't take away. Some of us, unfortunately, certain diagnoses, yes, they will take away the memories, but damn it, go make them anyway. Live them out the best you can.
They don't take them away at that moment. So
no, they don't. It's like Mark's has shared with me in the past that some nights are horrendous because he's in so much pain, but yet he forces himself to go to your daughter's on the flag team. Is that right?
Color guard, yeah.
Color guard. And you force yourself to the football games because you want to be there for your daughter. Why? The memories, right?
I wonder how I'm going to get back to the car when it's over, but hey, I made it.
But that's why you do it. And it sucks on Friday or the next day, but you're able to see her and see her enjoying herself doing what she's doing.
Yep.
And I can't imagine anything. I don't think there's anything probably better for a parent than to see their kid do what's making them happy in a way like that.
I do have a little victory too. Saturday, I needed brakes on my vehicle, and I've always done that stuff myself. Of course, I'm not able to get down and do it anymore.
Right.
So I was able to show my son. I was there to teach him and show him. So I still had that ability, even if I couldn't get down and do it. So,
Well, that's good.
Spread my knowledge, let's say.
That's what's
That
up.
is good.
That's what's up.
And you can send your son to my place when I need breaks.
Yeah. I'd be
Leslie,
happy to, because I'd like to come with him.
yeah, come on down. We got room. Leslie says she finally got the results for her MRI. That is awesome. Kate says the fifth doctor I saw approved me for the celiac plexus block. Was a very validating provider. God, it's nice to be validated by a doc, isn't it? It sucks, but that is such an important thing. That was when I walked into my current situation. That's why I made my commitment at that moment. Just because I was acknowledged, I was validated. Erica said about the wedding, he and his beautiful wife will be back here in West Virginia for their wedding reception. The 22nd, I've made all the centerpieces and ordered the food, been working on it for a month. Send me like a tasting menu.
Yeah.
Just make sure it's got like some like ice in the box so it stays healthy, and I'll let you know.
Maybe we could all get invited. Who knows?
Yeah. I mean, Kate, you're in Virginia. That's close. Kimberly says we're finally able to make it out of bed after being hit with horrible flu junk and being down for 2 weeks. Wow. That is horrendous. That's like when Val was in the hospital the last time I came down with that flu. It took me months to get past that. So I hope your recovery is much better. Robin says I had RFA last Thursday for a few months before could not get out of bed without taking something. RFA has helped so much so far that I haven't needed as much meds. Is that radio frequency ablation? Is that nerve ablation? Is that what I'm reading? RFA? I believe that's correct. If that's so, congratulations. I'm glad it worked for you. It's worked for me well in the past, and we may be leading up to that in my life and the low back and upper back, but we may have another Keith. What do you call it, Kevin? Keith does it, or Keith tries it?
Keith tries it.
We may have another episode with that coming up in a few weeks. Not the nerve ablation, but a different procedure, which will be filmed and stuff like that. We're still kind of in negotiations, and because that one involves a needle as well.
Simulator in you, is he?
No, we're not there yet. We're not there yet. Erica says all the food's Italian. Even more reason for you to send me a tasting menu. Jennifer says my victory is that we hit our family deductible for insurance. That hurts, but that is so good in a way. We're at 100% cover for the rest of the year. Therapy for all of us. It sucks.
Crazy. Keep
it's
going.
Barely even March. And Robin said that the RFA is nerve ablation. And congratulations on getting that done. I'm glad it worked for you. I am so glad it worked for you. Mark, do you have any final shots before I wrap this thing up tonight, sir?
Thank you for having me, brother. And anytime you need somebody to come in and talk about whatever, I'll be happy to.
Oh, I appreciate you. You have been such a blessing to the community and to these lives and to the Eclipse Pain and Recovery Network, to all of this stuff. You are like everybody's number one cheerleader, and it's been amazing. So thank you for your time tonight. Thank you for sharing that there's hope out there.
Oh, yeah.
Thank you for sharing that it's worth the shot to see.
Anybody invisible has any questions about somebody that's struggling, or if they're struggling, feel free to reach out to me anytime. Just search for Lugnut on TikTok and you'll find it. Try to be here Monday so we can share our horror stories and pain management. I think that has an opportunity to make some really good impressions.
And Keith, one more thing.
Yes, sir.
Jennifer had a question about it being, I guess, recorded videos. And I know you guys are going to go see them at some point in the future. So not only bringing your stories in to you guys, but if you could record them as well and send them to him, he's going to dump those to me, and I'm going to sprinkle the little sauce on them.
Okay. So people can't send me recorded ones. Okay. I knew that we were going to have a few play during the live, I think, like at the very beginning.
Correct.
But if we can do that too,
right.
That's
the
a bonus
sooner we
as
can
well.
get them, the better.
Yeah. Get them to me by Sunday morning, please.
Right.
Maybe Sunday at noonish, because I want to deluge Kevin. So
So how
just
do you
keep
want to
them.
do those TikToks or Reels or
You can record them in any way that you want. It can be a TikTok, it can be an Instagram reel, it can
okay.
be a YouTube short, but I need for them to be sent specifically to me, because if I download from TikTok or YouTube or from Instagram or another source, the quality will severely diminish.
Yeah.
So if you send it to me, and I can give you guys a list of different ways to send it, it'll be a lot better quality. So by the time Kevin gets it, it's better quality. So when it's presented in public, it's better quality, if that makes sense.
Well,
So,
they call me no pressure, so the more time, the merrier.
yeah. So again, it's Keith, Keitcha. I can't even spell my damn name right anymore. That's where my body has me. Keith, then the letters C as in cat, P as in Paul, P as in Paul at gmail.com. So that would basically work out to Keith Chronic Pain Patient. So Keith CPP at gmail.com. Email me. I'll send you my cell phone number and we'll figure out how to get it to me. And then we'll give it a Dropbox. We're going to send to Kevin and we'll have those. But also be here on Monday to share your story as well, because that's very important. So we can send this whole video to them so they can hear your stories and have your name attached. And so they can see it's real people with lived experience. So on that note, we are heading out for another week. I will see you Monday night with Dr. Lake. Mark, thank you again for being here tonight. Kevin,
thank you.
Thank you for being here tonight and for shepherding us and doing this remotely. That is appreciated. My body and my brain do appreciate you tonight, Kevin. And I hope everybody has a great week. Until Monday night, y'all be safe.
Good night, everybody.
Peace.
There you are, guys. Good job tonight. Good job. Great